almost any surgery, there's usually more than one option that would be reasonable, right? And so I'm trying to help a patient understand, here are the reasonable options. Here's the most likely outcome with each. Here's the good side. Here's the bad side. Here's what may happen down the road, and helping people to make those choices. The better I do, the more we share in this decision, the more likely my patient is to be happy for me.
Well, today we are joined by two VSI spine surgeons, Dr. Christopher Good and Dr. Ehsan Jazini. As two leading spine surgeons in the United States, they specialize in some of the most complex cases out there, including revision surgeries for patients who didn't get the relief they needed the first time. Well, today they're going to help us answer some big questions on this topic. Why do some spine surgeries fail in the first place? What should you do if you're still in pain? What do you need to do next? And then when is another surgery the right choice? When is it not? And how to move forward when you're stuck in a cycle of pain and unanswered questions. And by the way, if you are someone who prefers watching conversations like this, you can also find this full episode on our YouTube channel. Just search VSI on YouTube to watch today's discussion with Dr. Good and Dr. Jazini. So with that, I want to welcome you both, Doctors Christopher Good and Ehsan Jazini, spine surgeons at VSI. Thanks for being here, you guys.
Thanks, Laura. Welcome, everybody.
So first, let's define failed prior surgery. What does that even mean? Christopher, Good, let's start with you.
Well, I think, to me, any surgery where a patient has a surgery and they didn't end up having the result that they wanted or expected or believed they were going to have can potentially fall under this category of failed spine surgery. Now, that can be a huge range of how bad it is and how much it affects you, but I think that really what it comes down to, right? You had a surgery, you expected whatever problem to be improved in a certain way, and that didn't pan out. And so really a lot of that comes down to not only what was done surgically or what happened as a result, but what a patient expected or understood or wanted. And really, I think that's the critical part about it.
Dr. Jazini, would you say it includes if you have prolonged pain after your surgery, if the recovery is longer than you expected? I mean, does that fall into this too?
Oh, for sure. I think as part of that initial discussion and communication and setting expectations with the patient, if that's not clearly explained, they don't know what they're getting themselves into, right? Some surgeries, the recovery is really fast, and some surgeries may be up to a year of a lot of work. It's like a marathon that you have to do a lot of work from beforehand, before the surgery to prep for it, but also to recover from it. And so if that's the mismatch is there, like Dr. Good was mentioning, then you have an unhappy patient. And regardless of how well technically you may do that surgery, I would consider that a failed surgery.
And that's so interesting too, because I would never have put my expectation versus what the doctor has explained to me and there being a mismatch as defining failed prior surgery. But it's about information, right? Is that what you're saying, Dr. Good?
Well, yeah, I think when we're looking at almost any surgery, there's usually more than one option that would be reasonable, right? And so I'm trying to help a patient understand, here are the reasonable options. Here's the most likely outcome with each. Here's the good side. Here's the bad side. Here's what may happen down the road, and helping people to make those choices. The better I do, the more we share in this decision, the more likely my patient is to be happy for me, right? There are times when a small surgery might really work great, but it may not last very long before another problem. Whereas a bigger surgery may be a harder recovery, but a longer outcome, right? A longer success before something else may go on. And I have to help the patient understand those choices. And honestly, most of my patients who really are involved in making a decision, as long as we deliver what we expect, even if in the long run we need to do something more, they're bought into that. And so it's when you sign up for a surgery, you expect everything's going to go great, and then for some reason it doesn't, then you're disappointed or you're left with symptoms you don't like.
But isn't it also something has gone seriously wrong? I mean, how often do you see something like that where it's just gone not right, not as at all what they were expecting? And maybe there was something seriously wrong. Is that common?
I think we see people who come from all over, the country and the world with these kind of problems. So it's something we see, on a daily basis. I will say candidly, I think there's a very wide variability of what people do in spine care and spine surgery, maybe as much as anything else in the field of medicine. And I definitely see some surgeries that are done that are not the way I would have liked to do it or seen it done. And there are absolutely times when uh, surgery has challenges. We use spinal implants. You see them; they're not where you would have wanted them to be. They're causing problems. Something went wrong during recovery, and a patient developed a complication, and the surgery, multiple bad structural things happen. So we definitely see sometimes where we say, yeah, this didn't work out. This didn't heal. This didn't work. This needs to be moved into a new place. And success in those situations is all about understanding of the different things that can go wrong, like which ones are playing a role in any given patient and which ones have a reasonable chance of being fixed or remedied if you go back and do something more. It's obviously more complicated to go back if a surgery hasn't worked well, if things didn't go well inside. It's much more complicated to go back and put it all back together and then redo it than it is to try and get it right on the first time around.
Dr. Jazini, Dr. Good is saying that he sees this in his practice almost every day. Same for you.
Yeah, I think the most important thing is that we need to meet the patient where they are. And oftentimes, I think surgeons will look at a patient and says, "Well, how can I, within my skill set, help this patient?" And they're trying to fit a square peg with what their tools are, instead of meeting the patient where they are. What's beautiful about our practice and our model is that the surgeons as well, we do regenerative treatments. We work with really excellent physical therapists so that we can figure out what is the best option for the patient, not is surgery and what surgery am I going to do as the get-go or as a sole option. And so the first thing we got to step back and say, are we meeting the patient where they are? Because they may not be ready. Maybe their family situation is not in the place, their physical fitness may be not in the right place. So that's number one. Number two, there could be a myriad of options, right? And then we have to figure out what's the best thing for that patient, right? Because it's not the same, the exact same structural issue may not be have the same exact answer for each individual patient. So that individualization or customization is critical.
So, since you see this in your office a lot, I'm guessing that not all hope is lost when you've had a failed surgery. Would you both agree with that?
Not at all. I would actually say because those patients are usually suffering with so many other problems, those are the patients that can actually help the most
Mm.
oftentimes, right? Because they're already starting at such a desperate place. They're in so much pain and misery, right? So the threshold of that delta where I can take them from, a 10 out of 10 pain to giving them their life back, there is actually a lot more satisfaction and gratification because then I'm the hero, right? It makes actually my job in some ways easier because oftentimes the patients that come to us with failed back surgery have a major issue, right? We're doing a lot of other work for patients where we're just trying to improve their quality of life. They're still living life, right? They just want to improve their life and their quality of life. Versus the patients with failed back surgery, there's a huge delta. There's a huge place where I can actually step in and sort of be the hero and get them in the right direction.
So, how can you actually tell if the surgery has failed, truly failed? And then, what advice do you have for someone who may have had failed surgery, Dr. Good? How do you know?
Well, I mean, there are certain patterns that we recognize and we see all the time. And so, if a common thing that we deal with in the world of spine surgery is implants are placed many times that are meant to hold the bones together or fuse the spine. And there are times when those implants have not held, things have gotten loose, fusions haven't healed, and so sometimes that's plain as day. Not only a patient describes that, I know that's what it is, but I can look at X-rays or scans and I can see things are loose and it needs to be put back together again. When you're looking at it, there are a number of different structural issues inside a patient, things that can not heal properly or not have gone well with an initial surgery, which is way beyond like the topic of what someone listening to this wants to hear. But when you're dealing with this scenario, the critical thing is to understand this whole thought process from beginning to end and say, okay, surgery didn't pan out the way we want. We have to figure out, was the initial surgery done on the right area and targeting the right thing. Maybe there was something else going on that wasn't identified at that time. Or was it done to the right place and didn't heal well, or was the surgery not done in the areas it needed to be, and additional areas need to be considered? And and a lot of patients, it's actually some of both, right? You may see somebody who had a pretty complicated problem, and someone tried to do something small that didn't heal, and now that small thing that didn't heal is an issue, but the other levels that weren't treated are an issue. And so, really being able to take time and understand in a very thoughtful way how to work a patient up, understand what's going on. Because I think when we are going back in, if a patient's considering a revision spine surgery or a salvage spine surgery, you really want to do everything you can to be thorough, make sure you are very, very careful to get it right, because each successive time that someone has something done, it's more and more challenging to get them back to where you want them to go.
Mm-hmm. So, Dr. Jazini, let's me for an example. Let's play. What could be a situation for a patient listening or for myself. So, I had spinal surgery. I'm told I'm going to feel much better after this. I can't walk. 6 months later, and I can walk, but I can't. I'm not feeling right. Um, at what point do we just do I go in to see you or to get a second opinion and try to fix what's feeling so wrong? At what point do I make that decision?
Yeah, definitely at 6 months. I mean, I would hope that by that point you're already seen a specialist, right? Because to me, the trend line and that immediate, even the first couple of weeks, is really important. Generally speaking, what I would tell my patients is you should be improving, right? Every day should be a little bit better. You may take one step forward, two steps back sometimes, right? That's part of recovery. But the general outlook should be that you're improving. And if you're not, then we're missing something, right? So we're very thorough about getting our patients in right away, figuring out what's the problem. A lot of times, what I've seen happen is because other practices may be swamped, they're missing these early signs. I've had patients who came in, weren't weren't doing great, and then later on we found out, okay, actually there was an infection that was brewing in their spine, right? Those are very simple examples where if they sought help earlier, the problem would have been picked up and quickly mitigated, right? Because even despite all of our efforts, sometimes things don't go well, right? An infection can brew or something come up, right? And the key is you want to have someone taking care of you who's going to be there for you, who has empathy and has that relationship and closeness that you can quickly reach out to them when there is a problem, right? When things are not going well. When everything's going well, you're not going to probably even go back to your doctor, right? I mean, you forget that we even had surgery, right? So you want you want to be part of a practice or see someone that's going to hold your hand and make sure that you get to that finish line, and then also helps you with the maintenance care that you need afterwards.
So, what would you say, Dr. Tizini, are the red flags to look out for that tell me that I need to go in?
If your pain is not improving or getting worse, if developing any fevers, if there's any drainage from the wound, if any weakness in the legs are developing or in the arms, depending on where the surgery was done, these are all major red flags that you need to seek help immediately.
And is there a difference, Dr. Good, between slow recovery and an actual surgical failure?
Sure. We also, hopefully you've had an opportunity to talk to your doctor beforehand, right? Some surgeries are small with a very quick expected recovery. Others, you might be talking about a recovery over some number of months. So if what you're seeing is not matching what was supposed to happen, you
Hmm.
should be paying attention to that. You should be seeing your doctor more frequently. I think one reason to be doing some research and some thinking is if you're not doing as you expect, you want to be asking your doctor honestly, like, hey, we said we were supposed to be here. What's going on? Are there issues? And I think if you don't feel, that trust is really, really, really important. There are definitely times where there's a bell curve. Somebody's on the fast side, somebody's on the slow side, and they end up fine. But if you're not progressing and you can't get in to see your doctor, availability is an issue, or that you feel like what they're telling you is no longer something you can trust, it may be that everything's okay in there. But I think that really is an important time to say, hey, like, can I ask someone else just to make sure that we're not missing something? Because there are problems that treated relatively quickly are much more simple to take care of than if left neglected. I have a patient who's coming to see me from Florida who had a surgery that actually didn't work out in 2021, and actually really straightforward problem for us to fix, and as a very successful surgery. Because the first surgery didn't work and they've been hurting and they were kind of burned by that experience, they've been kind of living with this problem all these years. And reality is they're very thankful now, that very confident that we can fix this problem, and it's going to do great. But if you think about it, a problem left alone all those years, a pinched nerve left untreated, the longer it's pinched, the worse it gets. Not only is your quality of life being lost over the course of these years, but the longer you let the problem brew, perhaps the more you're sacrificing the success of the actual fix once you get around to it.
Mm-hmm. So you're both mentioning you see this every day at VSI. Why do you find that people come to VSI for this fix, Dr. Good?
Well, I mean, a part of that is 35 years of like, this is what we've done, and so you develop a reputation as being a place that is willing to take on these kind of things. The reality is, as a surgeon, taking on really complicated problems, redo surgery, revision surgeries is challenging, right? It's not the best way to have an easy life for you. And so there are practices that don't take on patients who've had surgery before, or don't want to engage in that. Our model at VSI is very much a more time with patients, lots of time thinking about details and planning and executing. And because we work with patients with that level of time and thought, that gives us a much better scenario if people have complicated surgeries that didn't work out, and we need to put all these details together, and we need to investigate and get multiple tests and talk multiple times. And so, because we're in a situation where we're here, in a little bit more of a patient focused, or people use the word concierge. I'm not my favorite word for this, but because we're in a model where we are used to doing those kind of things, it allows us to set ourselves up for success. If you're seeing, 50 or 60 patients in a day as a doctor, it can be really, really challenging to take the time you need in someone who's had a complicated surgery, and figure out what may be going on.
And Dr. Jazini, how would you say, like, if I'm 6 months out and not feeling good post surgery, not the outcome I wanted, how do I choose the other doctor to go to? Maybe I'm not trusting myself. How do I pick a doctor to go see?
Yeah, it's a great question. If first, it's always best to reach out first to that surgeon, right? You want to make sure that the person who has the relationship with you, you give them a chance,
Hmm.
because they're going to know you better than anyone else, right? And if you're not getting the warm, fuzzy feelings, you're not feeling that the person is being responsive, I think that's the time to do some research, right? Believe it or not, more than 50% of our patients find us on the web, right? Whether they're watching our podcast or going on these YouTube videos or talking to their physical therapist, or we get referrals from academic centers. The number one reason is reputation, right? Our results speak for themselves. So I think doing some research, speaking to your primary care doctor, you will find a good list of surgeons to go see in your area. We have patients who travel from all around the country to see us. But you want to select a surgeon who's comfortable taking care of patients with others who've had previous surgery, right? Because that's actually a huge barrier. A lot of practices they don't want to deal with patients who's already had surgery, because it is more demanding, more challenging. It takes a lot more time. You need a lot more resources. We have a phenomenal team here to help us get all that medical records, figure out what was done, figure out what was potentially missed. Oftentimes, it's a misdiagnosis. Like there's a problem that they address, but then they miss a whole nother issue, right? Because the spine is multiple areas and it could be easily missed. You can have something called double crush phenomenon, right? So I think picking a center that is institute like ours, where we have multiple specialists under one roof, where we can really hone in and figure out what can potentially was missed, and we can help that person, is the way to sort of help the patient pick a place that's going to be able to help them.
What are some other things that I need to consider then if I am doing revision surgery? What questions do you think I should ask?
Uh, what is it that you're going to do that's different? Like what was, first of all, what's the problem? Why am I not doing better? I think that's the number one question, right? What was my symptoms before that I'm trying to address, and what's changed? What's been the evolution of those symptoms, right? These are critical things as a patient. It could be really hard to actually remember, right? Because they've gone through this whole process of having surgery and then recovery, and it's really difficult for a lot of times. I actually tell patients to bring their loved ones with them to help piece together this story, and it's not and being patient and understanding, hey, this is going to be a process. I think is the first sort of advice I would give, and then you have to build that rapport, right, with your provider so that you can then come up with a solution that actually works, right? So those are the two important things that I would
Yeah.
tell my patients.
And Dr. Good, what about advancements in surgery? I mean, Dr. Jazini is telling me things that, yes, it may be hard for me to remember, but then, I don't know technologically what's happening in the field of spine surgery. How important is it going into the potential for a revision that I do get up to speed on the advancements and taking ability to take advantage of those?
Well, I don't think there's any piece of technology that will substitute for a great doctor, right? Um, I do think we've done a lot of work, and I'm a huge proponent of all kinds of technologies, of robotics and augmented reality and AI. And there's no question, as we look at how these technologies affect our surgeries, they help us to get better success for our surgeries. So I think that if you're doing research and you're finding someone who's involved in cutting edge advancements and research and training other doctors and these kind of things, like, that doesn't guarantee they're the best surgeon, but boy, that does shift the odds in your favor, that you're worth somebody who's out there doing new things, is aware of what's going on. And I think, patients ask me all the time about a technology and if I can use it in their surgery where it actually is not even applicable. But what I do like is somebody who's saying, okay, I'm trying to take ownership of this problem, right? Uh, I'm understanding I'm not doing well. Help me understand why. What about this? I'm researching on the internet. Is there this technology? There's this new thing. I checked out about this. If you can have a discussion with your doctor and they're like, yeah, I do that, but here's why, for your particular situation, that's not what I'd recommend. Oh yeah. Like, that is an appropriate treatment, but here's the reason that's not right for you. If you can find somebody who's got expertise and can help you understand all of these different options and help explain, this is your structural problem, these are your symptoms, this is why this is a better option. I have all these other tools available to me, but this is the best way to fix it. I think that's the way to go. It's very easy for a patient to come in and the doctor says, do this. Patient's trusting and they say yes. And that's awesome if it works perfectly, right? But if you don't take the time to explain to the patient, do this, and here's what I expect is going to happen, do you agree? Then there's a setup for these kind of miscommunications. And so yes, we use technology, and the more complicated a surgery is, the more technology has payoff for the patient in terms of success of their surgery, avoiding complications. But again, I kind of use the technology as a trick to try and make sure you're getting maybe in front of the right kind of doctor. I have to say, when I find something, I don't care if I'm putting a new roof on my house, fixing a scratch on my car. I'm a huge fan of finding somebody that I trust and getting a recommendation. And I almost don't do anything without that.
Yeah.
And it's hard if you're not medical to figure out how to get a great recommendation for a spine surgeon. But taking some ownership and really getting those connections. And nowadays, everybody's on these. I mean, everybody's on. I don't want to say the name of these different companies, but everybody's on these companies. They're chatting with each other. They're on social media. We're now finding people who are on neighborhood networks and certain social media platforms and support groups for one problem or the other, and they're talking to each other. And it's amazing how much power there is in that. And not only in terms of finding out, like, you are an individual, but your problems may not be unique to you, right? There are other people out there who've done this. What have they done to get a solution? Where did they go?
Yeah.
And I think again, it comes down to kind of taking the ownership as the patient to really try and put yourself in the right place.
And you both have talked about the collaborative element at VSI. Why does that matter?
Oh, that makes the whole difference, right? Because if I don't know, for example, I'll give you an example. A lot of times it's spine, especially low back. there's hip problems and back problems. And these two issues are very, very much interrelated. And it can be very tricky to figure out, okay, is the primary pain generator coming from the back or is it the hip? And it can be very confusing. And if you don't really recognize that there are potentially two problems and one is making the other worse, and you don't have a specialist in the house who can help you tease that, right? So if you have Dr. Ferrara, for example, or Dr. Mehta, who are also specialists with the hip, to help us tease that out, right? And so we have to be humble enough to know recognize, hey, there may be more than what I can chew here. Let me phone a friend. Let me phone someone who's an expert to help me figure this out.
The
So
body's so interconnected.
when you have this interconnected where you have the guy down the hall and you can go and talk to him, it's very different. I come from an academic center where I would have to send the patient to a neurologist, and they would go 2 months later see the neurologist, then I would have to read their note. There's a lot that gets lost in translation, right? So it's a huge game changer to have all of that in one roof where we can deliver care in a timely manner. I mean, the time of it is of essence. If let's say you're developing weakness, right? That's a huge piece of the value of this model.
Yeah.
But it's one is like being able to have multiple people like that you can have like together giving opinions makes sense. But the reality is, if you work hand in hand with people who are experts in other areas and you're examining patients together, treating them together, what happens? I learn from you, you learn from me, everybody gets elevated. And you have to be, you have to be together. You have to be working together, examining patients together. You got to be immersed in this together. And what kind of usually happens is, okay, go see this one kind of doctor, and if they don't know what to do, they send you to another doctor and another doctor, and they can all be great doctors. But if they're not interacting with each other, oh, this is what I examined. Oh, well, look, let me show you this. Here's the trick to this. And there's advancements in every field. If you look at, I think I had a pretty good training coming out of my fellowship. If you look at what I do now versus what I did 16 years ago, it is, yes, I had a solid foundation, but it's tremendously different. Mm-hmm. And if I were in a vacuum in my own practice, just doing what I did, not surrounded by physical therapists and physiatrists and, rehab doctors and neurologists and other spine surgeons helping each other and learning from each other, right? I would never have advanced to the same kind of place that I am. And there's lots of models that are set up different ways. Really having the doctors interacting with each other and taking care of you, I think not only is best for any given patient, but it elevates the entire medical team around you.
And it's more timely, as Dr. Jazini pointed out. It's much easier for me to put together a puzzle when I'm with my whole family than just doing it on my own. Much faster, much more effective.
And I wanted to kind of go back to this technology piece for 1 second. Technology is amazing. Like the way advancement in technology in spine surgery has been amazing in terms of like what I see, the surgery that my brother had 20 years ago to what I can do for someone with breast scoliosis now. But it does not replace the surgeon. It does not replace the human interaction. One red flag that I see with a lot of practices is the surgeon may learn one tool and the entire practice is built around that one tool, right? And then patients will come to me and say, hey, I want this particular surgery, and I don't want to pick on ultrasonics, but they'll be like, I want ultrasonics, right? That's a red flag because no matter, and I use that technology, I actually believe in that technology, but it's just a tool, right? At the end of the day, you're not just a technician, you're a surgeon, and you're there to help figure out, hey, does a person need surgery? What's the diagnosis and what's the best tool? And you want someone that's well versed with all these technologies and then can selectively use them to advance the patient's care, not, hey, I'm the ultrasonic guy and I'm just going to fix all the problems in the world with ultrasonics, right? Mm-hmm. That's where you get into trouble because then you're just trying to fill that square peg that I was mentioning earlier instead of looking at the patient, figuring out what is that I can do to help them.
Making it custom to the patient's needs. As you said earlier, meeting the patient where they are. Before we go, I want to wrap up with some key takeaways because this is so complex. There are so many moving parts to this. And as you both said, when you are trying to figure out what is still wrong with me, why didn't this happen the first time? Why couldn't I get it right? What do I do next? Offer some key takeaways for listeners on what do they do if they suspect a failed surgery?
So I think the number one thing that we all want to do is not have a failed surgery. Okay. So choosing your first surgeon is critically important in terms of decreasing your chances of needing a second surgeon. Okay. And we never have a better opportunity to get it right than the first time around. Okay. And so, obviously, if you're listening to this in your, you've had one and you need another, you've missed that window. But I think so many people are in this scenario. If only I'd have known, if only I had had that opportunity. So really, really look into that. And I think you need to look at your surgeon and ask yourself, if there is a complication, if things don't go right, is this the person that I believe I can trust and will stay by me and help me fix this? You want to choose the surgeon you would trust to do your revision surgery for your first surgery. And I think that's all about that relationship. I think doctors are humans, right? When time goes on, they don't tend to, it's hard to spend more time with patients with each visit. If you don't get a lot of time on your first visit, you got to start to say, what's going to happen down the road if I need the doctor more?
That's a good red flag.
So, every time I, it doesn't matter if I'm signing a contract to get a new car or whatever, I'm thinking this contract is there to signify what's going to happen if things go wrong, right? And hopefully everything goes right and it's beautiful and it's just like we wanted. But you want to look at your choice and say, okay, if we have bumps in the road, if there are challenges, is this the person, is this the practice that I trust is going to stay with me and be equipped to do those other things? If I'm choosing to have a little surgery, is this the doctor that can do the other surgery if that little surgery doesn't pay off? I'd rather have that same person who's expert at all of that take care of me rather than being in a situation where something didn't work out and I'm trying to get someone else to take over.
Dr. Jazini, what's a good takeaway for you? And what do you want listeners to go away with?
I think this is your body, this is your spine. More often than I see in real life, this decision is kind of taken too lightly, in my opinion. Now, maybe as a surgeon, I see, I've seen a lot of different things that a patient may not be exposed to. So I can't, the reason that happens is because we see the worst that can happen, right? And whether it's in training or in practice. And so it's a huge weight on me, right? So my advice is have a very honest conversation. You got to be able to, on a human level, connect with your surgeon, feel that they have your trust in you, right? And feel that that connection is there. Because if that's not there, if you're not bought into what they're going to do for you, it's going to really affect your recovery as well, right? Mental health aspect of this is a huge part of this. And so take your time, maybe get another opinion if you're not feeling sure, maybe even a third opinion, right? If you're not feeling that interaction that's easy, a surgeon who's comfortable with their trade, with what they're doing, is never going to get uncomfortable. So if you feel like they're getting tired of you asking questions, or they're kind of annoyed, that's a huge red flag. And so take your time. This is a big decision. And if I had a family member or even myself have to have spine surgery, believe me, I would be doing my due diligence. Obviously, I can't operate on my own family. I would have my partners like Dr. Good do it, but I would do that due diligence and make sure that I help them understand what is their problem, how can we fix it, and what's the longevity and the ramifications of those treatment options.
So prepare, follow your gut, ask good questions, get a second opinion or a third.
Yeah.
All right.
And take ownership and responsibility.
Take ownership and responsibility. That is very, very important. If you go on a vacation, you haven't done the good work, it's not going to be a fun vacation at all. Let's not apply vacation to spine surgery, but let's hope that the preparation does pay off. Dr. Christopher Good and Dr. Ehsan Jazini, both spine surgeons at VSI, thank you both so much for your insight on a very important and complex topic.
Thank you.
Thanks, Laura.